Today I'm going to talk about a case with a single deep ulcer in the lower lip. The patient came as shown in the second slide. A 45 years old male patient came with a 3 years history of a right lower lip lesion which was slowly enlarging. It was a non-healing ulcer. At presentation, the lesion was red and ulcerated and was firm but not painful. The patient gives a history for more than 30 years of smoking and indicates that the ulcer is right, as the patient said, that the ulcer is right where he holds his cigarette. There was no evidence of lymphadenopathy. Incisional biopsy was performed and submitted for histological evaluation. As we saw in the picture, our differential diagnosis, it might be a traumatic ulcer or an infectious disease ulcer or squamous cell carcinoma. First, if we say that it's a traumatic ulcer, we checked for intraorally for any cause of trauma, like a denture, broken composite or restoration, sharp cut, and we did not see anything that caused trauma. So our differential diagnosis is not traumatic ulcer. Also, the histological appearance does not support that diagnosis. Our last differential diagnosis would be an infectious disease ulcer because it's rarely an infectious disease came with a single ulcer. Also, there was no systematic symptoms, and the histological section does not support that the diagnosis would be an infectious disease. So mostly our diagnosis would be a squamous cell carcinoma, and our histological evaluation support that it is. Also, the clinical presentation of a non-healing deep ulcer and the age of the patient and the history of more than 30 years of smoking, it's a typical squamous cell carcinoma of the lower. Almost 90% of lips squamous cell carcinoma occurs in the lower lip, and 70% are due to sun exposure. However, it may also arise in the area where the cigarette, as in the patient, or pipe or cigarette are held. If we go back to the picture, we would see that the lesion, it's right where he held the cigarette. So also it confirms our diagnosis. And the lower lip squamous cell carcinoma has an excellent prognosis compared to the intraoral tongue squamous carcinoma. After histological confirmation of our diagnosis and it is squamous cell carcinoma, the patient was referred to a specialist for head and neck oncology. Because of the size with duration of the lesion, both local resection, lower lip, and supraomohyoid neck dissection was performed for the patient.